Friends, welcome to Priya Edu Plus. Today we will be seeing about acute respiratory distress syndrome. Before moving into the topic, friends, have you heard of term acute lung injury? Okay, acute lung injuries. First we will be seeing about acute lung injury, then we can see about acute respiratory distress syndrome. Okay, acute lung injury is also called as non-cardiogenic pulmonary edema. Okay, how the patients don't have the history of cardiac failure. In the absence of cardiac failure, the patients will be having abrupt onset of hypoxemia, and there will be bilateral pulmonary infiltrate will be present in these patients. Okay, acute lung injury is characterized by abrupt onset of hypoxemia and bilateral pulmonary infiltrate. Okay, acute respiratory distress syndrome is the manifestation of severe acute lung injury. Okay, acute lung injury is the milder forms. It will progress later into ADRS. Both the conditions, there will be inflammation. Because of that inflammation, there will be increase in pulmonary vascular permeability. As permeability increases, edema is formed, leading to epithelial cell death. This is the outline of the pathogenesis. Okay, friends, we can discuss it detailedly. Okay, in acute respiratory distress syndromes, there will be diffuse alveolar damage. This is a very important histological feature to be remembered in acute distress respiratory syndrome. Okay, let's see the causes. Direct lung injuries, it can be due to direct lung injury or indirect lung injuries. First we can see the common causes. It may be due to pneumonia or aspiration of gastric content. In case of direct lung injury, uncommon causes are pulmonary contusion, fat embolism, near drowning, and inhalational injuries. In case of indirect lung injury, it may be due to sepsis, severe trauma with shock. Uncommon causes include cardiopulmonary bypass, acute pancreatitis, drug overdose, and transfusion of blood product, and there can also be hypersensitivity reactions. Okay, friends, but the major causes to be remembered are pneumonia, aspiration of gastric canal, sepsis, and severe trauma with shock. Okay, more than 50% of cases of acute respiratory distress syndrome are associated with these four conditions only. Okay, friends, because of that, these four conditions must be remembered. Okay, now we can move into the pathogenesis. Okay, first, how does acute respiratory distress syndrome sets in? Okay, there must be either endothelial in them pulmonary endothelial injuries or injury to pneumocytes. Okay, injury to pneumocytes may be due to direct lung injuries. Okay, but pulmonary endothelial injury I can either due to direct lung injuries, or it can be also be indirect lung injuries. Okay, both these conditions lead to increased inflammations and pulmonary epithelium get damaged. Okay, the four important events that is taking place are: first one is endothelial activations, adhesion and extravasation of neutrophils. Third one is accumulation of intraalveolar fluid and formation of hyaline membrane. Third one is resolution to injuries. Let's discuss these four feature very detailedly. Okay, how they are taking place. Okay, each and every one. First one is endothelial activations. It is the first early event which is taking place. Okay, how it get initiated? There must be an pneumocytic injuries. This pneumocytic injury will be sensed by the alveolar macrophages, and it will cause the immune cells to secrete tumor necrosis factors. This tumor necrosis factor will act on the neighboring endothelial cells. Then endothelial cells will get activated. Because of this, the endothelial gets will activated. Okay, in case of sepsis or severe tissue injuries, and here there is direct lung injuries. In indirect lung injuries, then already there will be circulatory inflammatory mediators. This circulatory inflammatory mediators directly will activate the pulmonary endotheliums. Okay friends, here there will be pneumocytes injuries or absence in case of sepsis. Okay, in mediators, how they are activating. So, some of the mediators will directly injure the endothelial cells, but not all. Okay, other mediators, example, most important one is cytokines. They won't injure the endothelial cells, they will activate the endothelial cells to express increased level of adhesion molecules, procoagulants and chemokines. Okay, some of them will injure the endothelial cells, but important mediator cytokines, it won't injure the endothelial cells. It will, instead of injuring it, it will activate the endothelial cells to express increased level of adhesins. Okay, it is more important. Okay? Moving into next one is adhesion and extravasation of neutrophils. Okay, now endothelium has got injured, there will be there will be swollen endothelial cells also present. Already endothelial cells got activated and there is increased expression of adhesions are also present. Okay, the neutrophils in circulations, it will adhere to activated endothelial cells. After getting adherent to endothelial cells, it will get sequestrated into the interstitium and alveoli. In the alveoli, they get degranulated and they release inflammatory mediators. Important inflammatory mediators released by neutrophil is proteases, reactive oxygen species and cytokines. Okay, these are the work done by neutrophils. After that, what macrophage done is it will release migration inhibitory factors in the local environment. This migration inhibitory factor will sustain the ongoing pro-inflammatory response. Okay, with what it will cause? It will cause increased recruitment of WBCs, so leading to endothelial injury, and there will be formation of local thrombosis. This is the major event for the development of acute lung injuries or acute respiratory distress syndromes. Okay, next, moving into next one accumulation of intra-alveolar fluid and formation of hyaline membranes. I have already seen that endothelium has got injured and it also has got activated. So, what next is there is the pulmonary capillaries become leaky. As pulmonary capillaries become leaky, the fluid inside will come into the interstitiums and also into the intra-alveolar, leading to edema. As the fluid enters the interstitiums and alveoli, it causes edemas, and this fluid is going to damage and cause necrosis of type 2 alveolar pneumocytes. Okay, type 2 alveolar pneumocytes are involved in the synthesis of surfactant. As it get damaged, alveolar surfactants are lost, so it is going to compromise the gas exchange. Okay friends, now inside the alveoli, this protein-rich edema fluids and debris from dead alveolar epithelial cells will organize and it will form a hyaline membranes. Okay, around in the alveoli. Okay, inside the alveoli, the protein-rich fluids are present and debris from dead alveolar epithelial cells will get organized and they will be forming a hyaline membranes. It is very important. Okay, formation of hyaline membrane is very important. Okay friends, next one is dissolution of injuries. And then after sometimes inflammatory stimulus will get reduced. Okay, so macrophage will remove the intra-alveolar debris and they also release fibrogenic cytokines such as transforming growth factor beta and PGDS. What they will be doing, they will stimulate the fibroblast growth and they also cause collagen depositions. It will lead to the fibrosis of alveolar walls. Okay, in resolution phase, inflammatory stimulus get lessens. After that, after inflammatory stimulus got less, a macrophage will remove the intra-alveolar debris, and they also releases the fibrogenic cytokines. Example of fibrogenic cytokines released by them is transforming growth factor beta and PDGF. What they will do, these two factors, they will go and stimulate the fibroblast they will go and stimulate the fibroblast, leading to fibroblast growth and collagen deposition. Okay, then finally, and the fibrosis is formed in the alveolar walls. Okay, then next what happened is bronchiolar stem cells will proliferate, and it will replace the pneumocytes, and they will produce these type 2 pneumocytes will be producing surfactants. Then next one about blood vessels. Already uninjured capillary endothelium will be present. This uninjured capillary endothelium will proliferate, and endothelium get restored. Okay, let's see this diagram. I've already told that this is the macrophage. It is liberating tumor necrosis factors. This tumor necrosis factor act on the blood vessels, so it either injures the blood vessels, and some of them will cause activation of adenosine. Okay, then these are the neutrophils. It is getting attached to the blood vessels. Then the sequestration of neutrophils occurs. It then migrate into the alveoli, and they will be releasing is inflammatory mediators. Okay, inflammatory mediators such as protease, ROS, PF are released, and they cause further damage. And also, as the capillary blood vessels become leaky, fluids are gone outside into the interstitiums, and again they enter into the alveoli, and alveoli become fluid filled, and that protein rich fluids and the cell debris, it will get attached to the alveolar and alveolar wall, and hyaline membranes get formed. Okay friends, this is about the pathology, the pathogenesis. Next, moving into the